We just need to look. We just need to look. How long ago were the retina tests done?
Not long.
It's been 5 weeks.
Was it really?
Yeah, because we had to have her on the drops for 4 weeks.
So 5 weeks.
They did the electroretinal ultrasound on her, or they did not? Or they did not. Okay, all right. I thought okay.
They just did the eye exam like you did.
Gotcha. Okay.
They put the little pieces of paper in the eye. And they said she was a candidate for one, not the other, right? You were with me, Chris.
Does she navigate? Does she get around?
She gets around pretty well.
Hey guys, we're here with Agnes and Jay. We're at Dr. Carasto's office in Deerfield. Everybody send your prayers. Hopefully they're candidates.
So Agnes is a little bit different than Jay. Obviously, you can see how the eyes are not as cloudy as Jay's eye. And so she does have cataracts, but she has another problem on top of that. She has something called a lens luxation. And so the lens of the eye, again, it's just like the lens of somebody's glasses. It's usually clear and just focuses light for the eye. Anytime the lens of the eye develops a white spot or a cloudy spot that casts a blind spot on the eye, that's what a cataract is. Now, the cataract can be anywhere from 1% to 100% of the lens. The more the lens is affected, then the more vision is impaired. Her cataracts are 100% in both eyes. Now, you can visibly look at her eye and see that the right eye does not look as cloudy as the left eye does. And the reason that that has happened is that her lens has actually tumbled backwards. And so the lens of the eye it's round, and it has these little tiny threads that go 360 degrees around it that literally suspend the lens in the eye. It's almost like the frames of somebody's glasses, how they hold their glasses here. These fibers over time of her have broken down, and so her lenses are literally kind of wobbling around. And sometimes this can be a blessing, sometimes it can be a curse. There are dogs that have regained vision back because their lens slipped down and fell away. So they can have a cataract sitting here, they can't see a thing, but these fibers break down and the lens kind of falls away, and it's almost like taking the veil down, and all of a sudden they can see. So literally what's happened in the right eye is the lens has fallen backwards, and she has regained some vision in the eye.
Wow.
The concern with that is that they're a little bit more prone to having inflammation, they're a little bit more prone to glaucoma, but she's kind of done her own cataract surgery.
Really?
The left eye was not as fortunate. The left eye, the lens came forward. And so when it comes forward, they are at much higher risk to get glaucoma. They get damage to their cornea, and they are not, unfortunately, in many patients going to see, even with cataract surgery. So I'm going to tell you right now, she does have glaucoma in the left eye. Normal pressure in a dog eye, ideally we like them under 20. Right now her pressure in that left eye is 38, her pressure in the right eye is 16. So she has glaucoma in the left eye. So again, I agree 100% the left eye is not a candidate. The left eye we will not fix, so my goal for her left eye is comfort. So let me get an eye model here and kind of show you what's going on. And talk to you about what our
So the right eye is not a fix either?
Well, yes and no. And so here's the thing, is that she's kind of done her own cataract surgery. So you see that with the right eye. A couple of things that I encourage you to do is keep her hair clipped really short around the face, because that limits her peripheral vision. She's only got vision in one eye, so I keep that clipped a little bit shorter. So if you look at the anatomy of the eye, the front clear part of the eye, here's the cornea, the white part of the eye is the sclera. On the inside of the eye, you have the colored part of the eye, that's the iris, and the black hole in the middle gets big and small as the pupil. Now, right behind the iris is the lens of the eye, and the lens of the eye is normally clear, and when the lens turns cloudy, again, that's what a cataract is. So the lens looks like this, and again, what happens again when the lens gets a cataract, it turns white. The little fibers I was talking about are depicted by these little white lines. They are what suspend the lens in the eye to keep it from wobbling around. Now, if these fibers break loose, the lens can go either forward or backwards. There's a very large compartment back here in the back part of the eye, and the lens can fall down here. That's what's happened in the right eye. So literally what's happened is the white window shade got pulled down so she can see again. So
Amazing,
here's
huh?
the pros and the cons of that. That lens kind of wobbling around the back of the eye, it can cause some low-grade inflammation. So anti-inflammatories are important. The biggest concern though is the lens if it shifts up here in the front part of the eye. If it comes up here in the front part of the eye, they're much higher risk to get glaucoma. In some dogs, we can actually use the parts of their own eye to keep the lens in the back part. There's you can use the iris, which is the brown or the blue or the green color part of the eye. If you constrict the iris, you make the pupil very small. And so physically the size of the lens, it can't fit through the pupil to get up here in the front compartment of the eye. There are some dogs that their muscle, though, in their iris as they get older, it's not as strong, and you can't get the pupil to get down very small. I'd like to try her on that. I'm a little worried that her muscle may not be strong enough to get the pupil small enough. But if we can do that, that would trap her lens in the back compartment. The risk of glaucoma is much, much, much less. And in some dogs, we might just manage this eye with medicine, anti-inflammatories, and keeping the lens back. And sometimes surgery is not the answer for all patients. Sometimes, you know, that she's done a pretty good job by herself. The lens has fallen away. Do we not even want to mess with her eye and just kind of keep her where she's at?
I'm thinking that.
The other option is surgery. That's where we go in and take the lens out. So we go in and remove the lens. She would not be a good candidate for an artificial lens. Unlike JJ, his lens is where it should be. His fibers are all still in place. So we would go in and take the lens out, and the whole goal of that would just to be try to prevent her from getting glaucoma from the lens coming forward. Me personally, if she were my dog, I would treat her medically.
Okay, that's what I'm thinking too.
Her,
Sure.
Her left eye, though, she does have glaucoma in the left eye. So what's happening in the left eye, the lenses come up here. So that's the more unfortunate spot for it to be.
Is there medicine to put in that eye also, or not really?
So there are glaucoma medicines that we can use. Her medications, our concern with that eye is comfort. She is blind in the eye, so that eye is not visual, nor would ever be visual no matter what surgery you did on her.
You think it's painful?
Glaucoma can almost feel like a low-grade headache.
Oh,
It's
wow.
not like, ouchie, I just broke my bone, or, you know, so it's not ouchie like that, but it just gives you a pressure sensation. Sometimes you just have a low-grade headache. So we want to make sure her pressures are down within normal limits, and sometimes that's achieved with medicine. So I'd say we get her on some glaucoma medication and see if we can't re-regulate her pressure. The other thing, sometimes the non-steroidal anti-inflammatory agents, and that's the diclofenac, the gray cat medicine that you're on, may raise the pressure a little bit. So I might say we might want to put her on really more a steroid and get her off that and see if that also may help the pressure.
Okay.
If we can regulate her pressure with medicine and she's comfortable, fine.
Okay.
No surgery for her. If we can't regulate her pressure, then I would probably tell you for her left eye
To remove it.
take the eye out, or do a prosthetic eye, one or the other. So to me, for her, I can see back to her retina fine in the right eye. It's okay. As long as we could maybe keep this lens back here, then I think we can have a good chance to maintain what she has and not need any surgery.
Okay. Great. Just want to be comfortable if she can navigate herself around.
So I'm going to have Lisa put a
Right.
drop of the drug that constricts the pupil.
Okay.
And it usually takes about 30 minutes to get the pupil as small as we're going to get it. So I'd say we'll do the retina test on JJ.
Mhm.
One or two things, if you want to go grab a bite to eat, grab a cup of coffee, have a seat out front, fill up the car, whatever you want to do. I need JJ about an hour.
Okay.
And then what we'll do is have a look at the pupil on this right side and see
Okay.
what it's doing. And then get you set up just a little bit different change in the medicine
Perfect.
from what you're doing.
Perfect.
And then see how we do.
Okay. Sounds good, right?
Yeah.
All right, Miss Agnes, you did good.
You can bump, but you can see, Agnes.
Yes, you can.
You might bump around, but you can see and
I can see on the
navigate.
right side. The left side, not so good.
The
Perfect.
thing that happens though without a lens, so essentially she does not have her lens is fallen back. So without a lens, she can see, it's just not very focused.
Gotcha.
So especially things close up, like if you hand her a cookie like this, she'll use her nose.
Yeah.
That's what she
Yeah.
does. Yeah.
But so if you think of somebody that as they get older they need cheaters or bifocals, like everything out there is in focus, but everything up here is like and so she'll kind of do like that. So but that it's not that she can't see it, it's just that it's not in focus.
Focus. Okay. Awesome.
All right, well give me about an hour. I'm gonna
Thank
have you come
you.
and put that drop in her and
Great.
we'll figure it out. All right.
Thank you.
Thank you. All right.
She best. She's the best. I know, she's amazing, right? That's Dr. Carasto here in Deerfield. So thorough, so thorough. So now you heard everything that she said about Agnes. There's no surgery needed. She can see out of the one eye. They're going to change her medications on the other eye for the glaucoma. You can go right in, absolutely. Which is what they are doing right now. Trying to get the pressure down. And she's a little senior, very happy, very loved. We're going to get her a beautiful grooming and trim all that hair around that bushy face.
It comes back very quickly.
It does. I think we're going to go short for the summer, huh? A little puppy cut for you, huh? And then we'll just keep her on the right meds and we'll get her into a forever loving home. That's Agnes. Jay, you heard Dr. Carasto. He's in the back. They're doing all kinds of tests. In about an hour, we'll have an answer to see if he is knocking wood, a candidate, because he's blind as a bat. So we'll keep you posted, guys. This is Amy and Christy. We're here at Dr. Carasto with Agnes and Jay, 100 Plus Abandoned Dogs of Everglades, Florida.